I hope you're having a great day. Welcome back to our channel. And for today's video, we will talk about again another autobiography of a drug, which is the glycerin drug. So, first, we have to introduce ourselves together with my partner. So, I am Sheila May Torregosa, a level 2 student nurse of Visayas State University, together with my partner,
Ken Tupa, also a level 2 nursing student of Visayas State University.
Again, we will talk about the autobiography of the drug glycerin. So, let's get on to the video. Glycerin is an osmotic diuretic drug. Its generic name is glycerin. Its brand names are Fleet, Pedialax, Colace, and Glycerin. Its chemical name is C3H8O3, or also known as propane 1,2,3 triol.
My drug classifications, for my therapeutic classification, I am a laxative or an osmotic, and I am an ophthalmic osmotic, adjunct in treating glaucoma, and also lubricant. My pharmacology classification is trihydric alcohol or ophthalmic osmotic vehicle. So my pregnancy category is pregnancy category C, which means that animal studies have shown an adverse effect and there are no adequate studies in pregnant women, or no animal studies have been conducted and there are no adequate studies in pregnant women.
In the mechanism of action of the drug, there are two ways to administer glycerin. It is through rectal and through oral. So when administered rectally, glycerin exerts a hygroscopic and or local irritant action, drawing water from the tissues into the feces and reflexively stimulating evacuation. So glycerin decreases intraocular pressure by creating an osmotic gradient between the blood and intraocular fluid, causing fluid to move out of the aqueous and vitreous humors into the bloodstream. So when it is administered orally, glycerin helps reduce pressure by increasing plasma osmotic pressure, thereby drawing water into the bloodstream from extravascular spaces. It also reduces intraocular fluid volume independently of routine flow mechanism. Decreasing intraocular pressure, it may cause tissue dehydration and decrease CSF pressure. Topically, when glycerin is applied, it produces a hygroscopic or moisture-retaining effect that reduces edema and improves visualization in ophthalmoscopy or gonioscopy. Glycerin reduces fluid in the cornea via its osmotic action and clears corneal haze.
So my pharmacokinetics, so I have two forms, my rectal form and my oral form. So in the rectal form, so absorption, I am absorbed poorly after rectal administration. The laxative effect occurs in 15 to 30 minutes. In distribution, I am distributed locally. Metabolism, no information available, and through excretion, I am excreted through the feces. So next is my oral form. So in my oral form, absorption, I am absorbed rapidly from GI tract with serum levels peaking in 60 to 90 minutes with oral administration. Intraocular pressure decreases in 10 to 30 minutes. Action peaks in 30 to 2 hours with effects persisting for 4 to 8 hours. Intracranial pressure, also known as ICP, decreases in 10 to 60 minute effects, persists for 2 to 3 hours. So, in distribution, I am distributed throughout the blood. Although generally I do not appear in ocular fluids, I may enter the orbital sac when eye is inflamed with a consequent decrease in osmotic effect. The metabolism, so about 80% metabolized in liver, 10 to 20% in kidneys. So I am a substrate for synthesis of triacylglycerols and of phospholipids in the liver and adipose tissue. When fat metabolizes as a source of energy, glycerol and fatty acids are released into the bloodstream, circulating. Uh, when ion circulating does not glycate proteins and does not lead to the formation of advanced glycation end products, also known as AGEs. In some organisms, I am a component that can enter the glycolysis pathway directly to provide a substrate for energy or glucose production. I must be converted to their intermediate glyceryldehyde 3-phosphate before being used in glycolysis or gluconeogenesis. Glycerol metabolism, or my metabolism, is regulated by the enzymes glycerol kinase, systolic, and AD positive dependent G3P dehydrogenase and mitochondrial FAD linked G3P dehydrogenase, and I am excreted in feces and urine.
For the drug's indication, it is used as solvent, emollient, pharmaceutical agent, and sweetening agent.
So for my contraindications, contraindicated in patients with or who are hypersensitive to drug. Rectal administration is contraindicated in those with intestinal obstruction. I am also contraindicated in patients with anuria, severe dehydration, frank or impending acute pulmonary edema, severe cardiac decompensation, undiagnosed abdominal pain, vomiting, or other signs of appendicitis. Fecal impaction or acute surgical abdomen. Use oral form cautiously in elderly or dehydrated patients and in those with hypervolemia, confused mental states, congestive heart disease, diabetes, or cardiac, renal, or hepatic disease.
Side and adverse effect of the drug glycerin. It is categorized per body system. First, the cardiovascular effect. It causes hypertension and cardiac arrhythmias. Second, endocrine / metabolic effect. It causes hyperglycemia and hyperosmolarity, hyperosmolar non-ketotic hyperglycemia, and hyperosmolar non-ketotic coma. Third, gastrointestinal effect. It causes cramping pain, thirst, nausea, vomiting, and diarrhea for oral administration. Rectal discomfort, hyperemia of rectal mucosa for rectal administration. Fourth, hematologic effect. It causes intravascular hemolysis and hemoglobinuria. Fifth, hepatic effect. It causes hepatotoxicity. Or first is transient hepatomegaly. Sixth, neurologic effect. For the CNH, mild headache, dizziness, mental confusion, and amnesia with oral administration. Seven, ophthalmic effect. It damages the endothelial cell of the cornea, eye pain, and irritation. 8. Otic effect. It causes ototoxicity, temporary hearing loss. 9. Renal effect. It causes nephrotoxicity. Renal toxicity, acute renal failure, renocerebral oxalosis. And others, it causes, if abuse of laxatives, it causes abdominal pain, weakness, fatigue, thirst, vomiting, edema, bone pain, fluid and electrolyte imbalance, hypoalbuminemia, and syndrome that mimic colitis.
The responsibilities before I am administered. So a nurse should be certain of the identity of the patient before administering a drug and confirm this with the wristbands and ask the patient for their name and date of birth, as well as ensure that the patient is not allergic to the drug. The nurse should have a clear knowledge of medication to be administered, which is the glycerin, its medical use, regular dose, reported adverse effect, and any specific contraindications or precautions associated with the drug to prevent any untoward complications. The nurse should also be familiar with the treatment plan of the patient and the need for the drug to be administered to the patient, and perform a thorough physical assessment to establish baseline data before drug therapy begins to determine effectiveness of therapy and to evaluate for occurrence and any adverse effects associated with drug therapy. The nurse should also consider the dose, the route, and pacing recommended and equate this with the understanding and experience. The nurse should verify the drug's expiry date before giving the glycerin suppositories. Always increase the amount of high fiber foods that the patient eats and encourage them to drink plenty of water or use an osmotic laxative. And also, the nurse should consult physician regarding fluid intake in patients receiving drug for elevated IOP, although hypotonic fluids will relieve thirst and headache caused by the dehydrating action of methylglycerin. These fluids may nullify its osmotic effect.
Nursing responsibilities during administration. Monitor responses carefully when beginning therapy so that the dose can be adjusted accordingly. Provide thorough patient teaching, example, measures to avoid adverse effects, warning signs, need for regular evaluation, especially blood pressure, and etc. To enhance patient knowledge about drug therapy and to promote compliance with the drug regimen. Provide safety measures, example, adequate lighting, raised side rails, etc. to prevent injuries. The administration of the drug should be reported immediately in the patient's note clearly and accurately, with the nursing signing and printing their name and documenting the date and time the medication was administered. And lastly, monitor glycemic control in diabetics. Drug may cause hyperglycemia. Nursing responsibilities after administration. First, monitor patient response to therapy. Second, monitor for adverse effect. Third, evaluate patient understanding on drug therapy by asking patient to name the drug, its indication, and adverse effect to watch for. Fourth, monitor patient compliance to drug therapy. Fifth, evacuation usually comes 15 to 30 minutes after administration of glycerin, rectal suppository for enema. Note, slight hyperglycemia and glucosuria may occur with PO use. Adjustment in anti-diabetic medication dosage may be required. Do not breastfeed while taking this drug without consulting the physician. And lastly, after prescribing the drug, the nurse should complete the necessary paperwork. And that's it for today, guys. Thank you so much for watching, and I hope you learn and enjoy watching our video together with my partner Kent. So that's it for the autobiography of the drug glycerin. I hope you watch our future vlogs and videos about autobiography or of another drug. Thank you so much for watching!